What's the best way to improve healthcare in the United States? Is it through government intervention or free market principles? This is a question that has been at the center of the healthcare debate for decades. The healthcare industry in the United States is one of the most complex and controversial topics of our time. It's an industry that affects everyone, regardless of age, gender, or socioeconomic status. With the rising costs of healthcare, it's no wonder that people are concerned about the future of the system. Supporters of government intervention in healthcare argue that it would provide healthcare to all citizens, regardless of their ability to pay. This would ensure that everyone has access to basic healthcare services, which is essential for maintaining good health and preventing illness. Programs like Medicare and Medicaid, which are funded by the government, have been successful in providing healthcare to those who cannot afford it, especially the elderly and low-income individuals. However, critics of government intervention in healthcare argue that it would lead to increased taxes and bureaucracy, which could result in lower quality care and fewer choices for patients. The high cost of healthcare is already a major issue in the United States, and many believe that increased government intervention would only exacerbate the problem. Additionally, critics argue that government-run programs would stifle innovation and competition, which could ultimately lead to higher costs and lower quality care. One of the main arguments against government intervention in healthcare is that it would lead to a lack of choice for patients. In a free market system, patients have the ability to choose their healthcare providers, and competition encourages providers to offer high-quality care at reasonable prices. In contrast, government-run programs may limit patient choice, as the government would be the sole provider of healthcare services. This could result in long wait times for appointments and procedures, as well as limited access to certain types of treatments. Critics of government intervention also argue that it would lead to decreased innovation in the healthcare industry. In a free market system, healthcare providers are encouraged to innovate and develop new treatments and technologies in order to remain competitive. In contrast, government-run programs may not have the same incentives to innovate, as there is less competition and less pressure to develop new treatments and technologies. Supporters of free market principles argue that competition and innovation are essential to improving the quality and affordability of healthcare. In a free market system, healthcare providers are incentivized to offer high-quality care at reasonable prices in order to attract patients and remain competitive. This can lead to increased efficiency and effectiveness in the healthcare system, as providers are encouraged to find ways to offer better care at lower costs. In addition, supporters of free market principles argue that removing government regulations would reduce bureaucracy and allow healthcare providers to operate more efficiently. This would allow providers to focus on patient care rather than navigating government regulations and red tape. However, critics of free market principles argue that a market-driven healthcare system would result in unequal access to healthcare, with those who cannot afford it being left behind. Without government intervention, there may be no safety net for those who cannot afford healthcare, which could result in serious health consequences for low-income individuals. Critics also argue that the profit motive of private companies could lead to a focus on profits rather than patient care. In a free market system, healthcare providers may be incentivized to cut corners or prioritize profits over patient care in order to maximize their bottom line. This could ultimately lead to higher costs and lower quality care, as providers may prioritize profit over providing the best care possible. When it comes to finding a solution to the healthcare debate, it's important to consider both government intervention and free market principles. One potential solution is a hybrid system that combines elements of both approaches. In this system, the government would still play a role in providing healthcare to those who cannot afford it through programs like Medicare and Medicaid. However, there would also be a focus on competition and innovation, with private healthcare providers being encouraged to offer high-quality care at reasonable prices. To achieve this, the government could provide incentives for healthcare providers who offer high-quality care at lower costs, such as tax breaks or grants. At the same time, the government could also enforce regulations to ensure that all healthcare providers meet certain quality and safety standards. Another potential solution is to implement price transparency in the healthcare system. This would require healthcare providers to disclose the prices of their services upfront, allowing patients to shop around for the best value. By increasing price transparency, patients could make more informed decisions about their healthcare and providers would be incentivized to offer competitive prices. Finally, increasing access to preventative care could also be a potential solution. By investing in preventative care, such as screenings and vaccinations, healthcare providers could catch and treat illnesses before they become more serious and expensive to treat. This could ultimately reduce healthcare costs and improve the overall health of the population. The healthcare debate is a complex and controversial issue that has been discussed for decades. Both government intervention and free market principles have their pros and cons, and it's up to policymakers to determine which approach is the best solution for the future of healthcare in the United States. As citizens, it's important for us to stay informed about the issues and to advocate for the approach that we believe is the best solution.